Hello, and welcome to the 2020 Brain and Transcranial Photobiomodulation Virtual Summit. I'm your host, Dr. Joe Dodaro, and my guest today is Dr. Ivan Maksimovich, with the help of his translator, Alexander Skolnick. As way of introduction, Dr. Ivan graduated from the first Moscow Medical Institute in 1979, specializing in cardiovascular surgery. After graduating, he worked in leading research institutions and clinics around the country. Since 1993, Dr. Maksimovich is the head of the Clinic of Cardiovascular Diseases named after Most Holy John Tobolsky in Moscow. In 2004, Dr. Ivan defended his PhD thesis for the degree of Doctor of Medical Science on the subject of transluminal laser angioplasty in the treatment of ischemic brain lesions. He's the author of more than 280 scientific papers devoted to transcatheter treatment. The main direction is the treatment of vascular diseases of the brain, dementia, Alzheimer's, and Binswanger's disease. And he comes to us from Moscow, Russia. Thank you for your participation, Doc.
Спасибо за участие ваше. I will say what you tell. Он ввел вас, сказал, кто вы такой, и сколько у вас публикаций, и так далее, и так далее. И благодарит вас за участие. Окей. Вот. Вы хотите что-то сказать?
Скажите, тоже благодарю его. Скажите, что я его тоже благодарю.
Он вас, he also send you his thanks.
Wow, that's great. This is the first time that this is going to be, we're talking about this, and the results are pretty great. So let me give you an overview of this. In the early 80s, we were developing a method of percutaneous transluminal laser angioplasty to restore the permeability and lumen of atherosclerotically occluded arteries. So you were trying to open up occluded arteries. In the course of extensive research, we studied the effects of various types of lasers on atherosclerotic tissues, the vascular wall, and the surrounding tissues. Researchers have included both the use of lasers with low output power and the use of lasers with high output power. In conducting these experimental studies on the effect of laser energy on various layers of the vascular wall, it was found that the range from 600 to 700 nanometers laser energy is moderately absorbed by the atherosclerotic tissues, the intimate and the muscular layer of the cerebral vessels. That's 1.5 to 2 units of absorption, as we're going to take a look at.
Slide 2.
I hope. Yep, I hope so. In this case, the depth of penetration of the laser energy into the surrounding tissue, including the cerebral tissue, is about 20 to 40 millimeters. It was also found that with a decrease in the wavelength, the absorption of laser energy increases significantly, and with an increase in the wavelength, the absorption decreases, allowing a significant part to pass into the surrounding tissue, which can lead to tissue damage. This would be damage in the cerebral cortex. In further studies on experimental animals, it was found that with transluminal, and this means transcatheter use, the laser energy of the helium neon laser actively stimulates physiologic angiogenesis, which we will see, causing a rapid opening of the arteries and capillary collaterals, which we will observe here. The Ministry of Health has given permission for the clinical use of this method. In carrying out transcatheter interventions on vessels of the lower extremity affected by atherosclerosis, it was found that 20 to 40 minutes of exposure to a helium neon laser energy with a power at the distal end of the fiber optic instrument of 20 to 25 milliwatts stimulates angiogenesis. This in turn leads to opening of a pronounced arterial and capillary collateral network, which significantly improves blood supply, reduces ischemia of the lower extremity, promotes healing of trophic ulcers, and avoids the development of gangrene and the subsequent amputation. Laser transcatheter innervations on atherosclerotically affected coronary vessels, also called angiogenesis, and the opening of the pronounced capillary collateral networks of the heart, As a result, blood supply is improved, regenerative processes developed, and the area of post-infarct ischemia is decreased. All these factors lead to faster rehabilitation of the patient and better perfusion of the end organ. The conducted studies have allowed the development of the method of transcatheter laser revascularization of cerebral blood vessels. This is 2 patents. One part of this method was the restoration of the cerebral distal arterial and capillary blood. Oh, it's better be recorded. By stimulating angiogenesis using transcatheter laser at low output, which in fact is transcatheter intracerebral laser photomodulation therapy. I got you.
Okay. So
we're going to review the work of Dr. Maksimovich from the cardiovascular clinic at St. John Tobolsky's in Moscow, Russia.
Yeah.
We're going to review the transcatheter intracerebral photomodulation therapy in ischemic brain disorders. I'm very pleased to go forward. Forward?
Next slide.
Yes. So this graph is a graph of the absorption of the vascular wall of laser energy in the wavelengths between 300 and 900 nanometers. Now, this is the question that I have based on the introduction, is the more energy that is absorbed by the vascular wall, the less energy penetrates into the brain tissue. Is that correct?
вопрос такой, чем больше энергии вы подаете, тем меньше потребляется тканями.
Нет, не совсем. Чем больше я энергии подаю, тем больше они потребляются тканями.
The more energy you introduce, the more energy is absorbed.
Very good. Okay, so we'll get to this. We'll get to this because I want to know what is the 0 to 3 on the left-hand side? What does that indicate? Deeper? Is that millimeters or is that per power? What is it?
От 0 до 3. Это вот по шкале абсцисс, по шкале ординат. Что это от 0 до 3 обозначает?
Единицы поглощения лазерной энергии тканями.
It's units of absorption of laser energy by the tissue.
Very good.
Волны от 600 до 700 миллиметров получается равномерное проникновение ткани. Если рассчитывать это на головного мозга, это будет 20-40 миллиметров.
Я понял, почему и вопрос. I understand your question because you can see that the three, it is not the energy, it's the wavelength, 300 nanometers, 400 meters. It's nanometer range on the abscissa axis, and on the ordinate axis, it is degree of absorption. You know.
Right. So that's what I was looking at. This is integrated with the earlier study, earlier introduction. Thank you. Go ahead.
Это интегрировано с более ранней стадией, да? Который вы описали в introduction там.
Да, в introduction это как раз все описано. Я хотел...
This is exactly what is written in introduction.
Very good.
Okay. We return back to that slide.
Let's go forward, yeah?
To the last one which you mentioned?
No, let's go to, let's do them forward.
Следующий слайд. Следующий здесь.
So as an introduction, this research focused on the clinical application of transcatheter intracerebral photomodulation therapy in the treatment of ischemic brain lesions. When we look at the materials, we had 1,708 patients with a distal intracerebral ischemic lesion were selected and were divided into the following groups. 911 patients with cerebral arteriosclerosis and with chronic cerebrovascular insufficiency, median age was about 74 and a half, were mostly men, 74% men. Of these, 2.5% had Binswanger's disease, which is a vascular dementia, or type of vascular dementia, I think. and the 5% had vascular Parkinson's. There was also 796 patients in this group that had cerebral arteriosclerosis and previous ischemic stroke of varying severity. And their mean age was the same, about 74 and a half. And again, the majority of them were almost 75% male. These were our groups.
Next slide.
We examined the patients with computed tomography, CT scans, MRIs, CDR assessment, MMSE assessment, the BI assessment. What is that, Alexander? What is that one
But
called?
the BI assessment, I had written out. What's the BI assessment? Это B1,
Bartel index. Bartel index. Bartel index.
Barrow.
Какой барометр индекс?
Bartel, фамилия Bartel index.
Biden index.
Bartel.
But let me look. I have this. I wrote down BI in my records. Иван Васильевич, еще раз. Как имя Байден? Байден?
Bartel, Bartel.
Bartel assessment.
Да.
Yep. They did cerebral scintigraphy, rotent encephalography, cerebral multi-gated angiography, which is different than the cerebral magnetic resonance angiography. So it was much deeper.
Yeah.
In group one, these were patients that had chronic cerebral vascular insufficiency, as well as atherosclerosis. We were divided them into two groups, the test group and a control group. In the test group, there was about 64% of the patients underwent this transcatheter intracerebral photobiomodulation, and the control group, they received conservative care. Group two was the same, that was the second group that we looked at with these distal intracerebral atherosclerosis who also previously had an ischemic stroke. This study involves patients who suffered a stroke in the period of 6 months to 6 years before the treatment. So all of them had chronic post-stroke. In the control group, the test group was 62%, or about 596%, so 596 of the 700 or so patients underwent the transcatheter intracerebral photobiomodulation. They were broken down according to the size of their ischemic lesions. Small focal lesions was the majority at about 57%. Midfocal lesions, about 31%. And macrofocal lesions, large lesions, were about 12%. The control group was quite similar. These patients had conservative care for their small focal strokes, midfocal strokes, and macrofocal strokes. So demographically, they were quite similar.
Next slide, please.
In their evaluation of clinical results, I want to point out that they were followed up for a period of up to 10 years. So this is extensive follow-up. And good clinical results were decided by them reaching these two parameters: almost complete restoration of mental and motor function in daily life activities. So they returned to normal. And then by the Bartlett Index and the MMSE, these are normal, top of the ceiling. Satisfactory clinical results were incomplete restoration of mental and motor function and daily life activities. While these are still considered near normal, we consider those satisfactory. Relatively satisfactory clinical results were partial restoration of mental and motor function in daily life activities. This would be a slight decrease in the two indexes. And relatively positive clinical results were absence of negative dynamics with a slight restoration of mental or motor functions in daily life. So the point I want to make is relatively positive was still no negative. That's as important.
Yeah.
They didn't deteriorate. At the bottom of the clinical results was just nothing negative happened, but maybe a slight restoration.
Что вот последний relatively positive result, это не разрушен был, а все-таки был какой-то результат.
Да, незначительный результат.
Вот.
Незначительный результат.
Незначительный, да, незначительный, но не разрушение, но destruction.
Нет, не разрушение, просто незначительное, небольшое улучшение состояния.
Just slight improvement in condition.
That's good, but nothing negative. They didn't deteriorate.
Ничего не было negative. No.
So in the conservative treatment group, they received their usual and similar regimes of drugs and doses that were used clinically: aspirin, heparin, non-direct anticoagulation, several drug therapies. So they were taking care of it the best that they could. Go ahead.
Okay. So, next slide.
Mm-hmm.
Next.
Yeah.
So, under cath lab conditions, this is how we did our intervention of the transcatheter intracerebral photobiomodulation. Under local anesthesia, following Sendlinger technique, the common femoral artery is punctured and catheterized with a setting of an introducer of 6 to 7 F in diameter. Through this introducer, guiding catheters are drawn coaxially, being first installed in the internal carotid artery and then conducted into the intracerebral branches. Through these catheters, a thin, flexible fiber optic light guide instrument, which is connected to the laser and is of 25 to 100 micrometers in diameter. That is introduced. This fiber optic instrument is guided to the distal sections of the anterior and middle cerebral arteries, where laser exposure is then performed. During the intervention, under X-ray television control, Omnipac 350 is injected in small doses to position the light-guided instrument correctly and specifically. Photobiomodulation therapy is carried out using helium neon laser with a power of 25 milliwatts. The total laser exposure time is about 1,200 to 2,400 seconds. And after the transcatheter intracerebral intervention, a second cerebral MUGA is done, like an MRA angiography. Based on the results of the MUGA, the severity of the intracerebral angiogenesis and the extent of collateral and capillary revascularization and restoration microcirculations are assessed. This is the vascular thing. No, how long was it, Alexander? How long was it between the first and the second MUGA?
Какой период был между первой и второй МУГа?
Где-то 1,5 часа. Это время перед операцией делается МУГа.
Что?
Сначала делается ангиография, потом
is angiography, and then
делается интервенция.
Intervention.
И после интервенции делается вторая МУГа.
And after the intervention, second MUGA. Это все варит сколько? 1,5 часа?
2 часа, может быть.
About 2 o'clock. 2 hours.
So 2 hours. That's the question. That's an immediate change. That's what I suspected. But it's an immediate change, right?
Мгновенное изменение происходит. То есть практически
прямо на глазах. Это время воздействия 120-240 секунд.
Yes.
И после этого времени изменения уже наступили.
Just in your eyes and observation. Wow. Current observation, just you can see that.
In 2 hours. In 2 hours. That's amazing.
Approximately 2 hours.
That's amazing. So this is an example of patient K. Is a male of 38 years old. And the CDR1, what does that indicate, Alexander? So the CDR1, what is that?
Что такое CDR1?
CDR первая стадия. Clinical Dementia Study.
Clinical Dimension Revascularization, да?
Clinical Dimension Study.
Gotcha.
Clinical Dimension Study.
I heard him. Chronic cerebrovascular insufficiency. This is a CT of his brain before and 8 years after two-sided transcatheter intracerebral laser photobiomodulation. So before the intervention, we have multiple post-ischemic cysts, which we should be able to see as these white dots right there. Are we seeing them? Did I put the arrows in the right place?
Yes. Это правильно, в правильных местах стрелки, вот там белые пятна, white spots. Yeah.
Gotcha. And then we have an increase in calcium in the vascular wall and the symptoms of atrophic changes in his brain, that we can see as number 3. So number 1 was the multiple ischemic spots.
Yes.
Number 2 arrows show us some calcium in the wall, so I can see those white parts there. And number 3 is the atrophy. You can see that mostly in the frontal sulci.
Yes.
And now 8 years after the intervention that he did both sides, we have a restoration of the brain tissue, and the sulci are back to normal, and the ventricles are reduced. So that's very positive.
Okay. Maybe, Dr. Didur, maybe you will tell next slide.
Go ahead.
Okay, or I will do it, doesn't matter.
How do I say advance in Russian?
Just say next slide.
Next slide.
He understands that.
Следующий.
Да. Когда он будет next slide, это значит следующий слайд. Next slide.
This is the same patient K in the left-sided carotid angiogram, the lateral projection. And this is the left-sided. Before and after the transcranial intracerebral laser photobiomodulation of the anterior and middle cerebral arteries. So if we look at this, these arrows over there are showing the fine, these are arterioles, Doc. These are the arterioles that we're looking at, not the arteries, right? These are the fine arterioles, correct?
Arterioles. Before the occlusion of the distal branches, мы здесь arteries, cerebral artery.
Still the arteries. These are stenosis and occlusions, and this is after the intervention. We see angiogenesis stimulated, arterial collateral and capillary beds are restored, and this is in the we're looking at this mostly, and I see this in the posterior, if I'm not mistaken, the posterior aspect of these angiograms. Just as the light, you can see that there's more opening and more darkness, right? So this is an improvement in his circulation.
Что он говорит, Александр Николаевич?
Can I ask?
Можно видеть, что большая часть артерии раскрылась на правой части. Yes. More openings of arteries on the right side.
May I ask how many points of stimulation did the doctor have to do to accomplish this?
How many, what? How many?
How many points of laser application were needed to accomplish this result?
How many points?
Yes, he did 2 arteries. And how many times did he have to turn on the laser?
Сколько раз нужно включать лазер? Сколько точек, которые вы это делаете?
Ну, это лазер включается, и световодный инструмент, файбер-оптик, продвигается по сосуду.
Нет, сколько раз там разных точек вы это
там нету точек. Лазерный световод идет по просвету сосуда. В это время работает лазер.
Вы медленно двигаете его?
Да.
He slowly moves the laser through the opening of the vessel, and the laser is treating that.
So it's continuous.
It's a continuous process, no stopping.
It's a continuous process. Now, if he could he indicate by putting it along the artery, how far can he reach? How far down can he go in this little artery? Can you show me?
Okay. Вы можете показать, как глубоко в артерию может проникнуть?
Ну, вот левый снимок по стрелке.
Left, follow the cursor on the left picture. You see?
He can go all the way down there? He can keep going all the way to there?
Вы продолжаете так глубоко? Да?
Ну, это лучше.
Вы сможете так проникнуть туда?
А световод всего-навсего 50 микрон, так скажите. Толщина световода 50 микрон.
Thickness only 50 microns.
Wow.
The diameter of the light guide.
Wow, that's unbelievable.
Very thin one.
Wow.
It is a microcatheter.
Ah, wow, that's amazing. That's amazing. That's amazing.
You can see it in the patent, in US patent.
Yes, that's amazing. Go ahead. Next.
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 I couldn't understand the word points because it's just moving. No
Patient I was a male, is a male, 74 years old. He has disseminated subcortical atherosclerotic lesions of the brain and white matter. And he was a Binswanger dementia in this study. Before and after we conducted the intracerebral transcatheter laser PBMT. So in the picture number A, or letter A, the right internal carotid artery angiogram in the arterial phase before the intubation, we can see depletion of the capillary beds in the white matter. Multiple subcortical intravenous shunts. Those are, we would see those as going sideways. I understand that. And then we have the right internal carotid artery angiogram of the venous phase. Multiple subcortical arterial venous shunts also being shown there. Number C is the right internal carotid angiogram arterial phase after the intervention. And you could just see visually the blackness, which is more blood. The angiogenesis was stimulated in number 3 in all those areas, quite improved, a lot of improvement. Arterial collateral and the capillary bed restoration. Oh, that's pretty amazing.
Okay.
And the right internal carotid artery venous phase shows the closing of these arterial venous shunts. Now, I'm going to ask
Yes.
a technical question.
Технический вопрос к вам.
Пожалуйста.
Okay. So this is the internal carotid artery.
Это внутренняя артерия.
Сонная артерия.
Да.
Yes. Now,
Internal carotid artery.
yes. So these arteries that we're looking at and the veins, they are still on the surface of the brain. They're not going deep into the brain.
Поверхности мозга, а не внутри. Это на поверхности мозга.
Нет, это внутри мозга.
А?
Это внутри мозга.
Inside the brain.
They're inside the brain, but they are still like you don't have arteries, deep in there. Because these are, that's what I'm saying. I'm just saying.
Внутрь там идут тоже артерии, внутрь мозга?
Да, конечно, она идет в ткани, в самой ткани мозга, и там идут артериолы и капилляры по всему мозгу.
По всему мозгу, over the entire brains going capillaries,
That's right. It's the capillaries that go deep into the tissue.
Yeah.
That's right.
Deep.
Thank you. Go ahead.
Next slide.
This is an example of patient A, a female of 58 years, also in the dementia study. This is an MRI of her brain 8 months after a macrofocal ischemic stroke. It was a large one in the right hemisphere, and 10 months after the transcatheter intracerebral laser photobiomodulation in the right middle cerebral artery. Before the intervention, they see a huge post-ischemic region in the occipital parietal lobe as indicated by those arrows in the right hemisphere. And you can see that those are, what we see that is the white areas that are being, that we're showing, or we're looking at, because this is ischemic, it's the black that we're noticing, correct, Doc? The black areas.
Зачерненные зоны, да?
Вот, я показываю стрелкой. Вот область инсульта.
It shows the area by the cursor.
And 10 months.
А вот это область после проведения лечения.
Oh.
Это после лечения, да?
Справа после лечения.
После, да?
Да, слева вот это вот до лечения, вот это вот после лечения.
Yeah, right side after the treatment.
There's a significant decrease in the size of the cyst, post-ischemic cyst, with the signs of brain tissue structure restoration. That's pretty amazing.
Okay.
It's pretty amazing.
Что он хотел спросить, Александр Михайлович?
Он спросил просто, какие зоны, все, вы показали. Он говорит, что это удивительно.
Next slide, спросите.
Next slide.
Here we have patient, same patient A with a right-sided carotid muga with the macrofocal ischemic stroke to the right hemisphere before and after transcatheter cerebral laser photobiomodulation to the middle cerebral artery. So we did the middle cerebral artery, but this is a right-sided carotid exam here. And you can see that before the intervention, occlusion of the distal branches of the right middle cerebral artery. And post angiogenesis stimulation, arterial collateral and the capillary bed restoration, and significant improvement in the collateral blood flow, specifically into the back there, even in this lower area here, even down there. So significant irrigation of the tissue.
Yes. Да, значительная ирригация с кровью, tissue.
Go ahead.
Ткани, да. Видно, заметно, как кровь орошает все это.
Ну да, конечно.
Yes, it's seen there. Irrigation by blood.
Yep. Next.
Только не ирригация, это все-таки кровоснабжение.
No, he used the word irrigation like blood supply. You know, it's synonym. Synonym.
Ну, скажите, что в русском языке ирригация все-таки относится к сельскому хозяйству.
In Russian, he said irrigation relates to agriculture.
I understand, but we're bringing the blood into the brain. We opened up the gates.
Yeah. На английском можно так сказать, потому что кровь орошает мозг, ну, это фигурально.
Ну, естественно, просто...
Окей.
Next slide.
Следующий слайд, да.
So when we look at the results, in the test group 1 that had atherosclerosis and cerebral ischemia, an immediate good result after the transcatheter intracerebral laser photobiomodulation, according to the Muga data, manifested by pronounced angiogenesis and collateral capillarization, was observed in 96% of the patients. So we observed clinically by looking at the data, pronounced angiogenesis, revascularization in 96% of the patients. A good clinical outcome was observed in 77%. Satisfactory clinical outcome was observed in 20%. A relative satisfactory clinical outcome, partial recovery, was in only 3%. And no negative trends or with a slight mental and motor function reduction was only seen in less than 1%. So like 2 people. And in the control group, if you look at that, we only had a 10.5% had good results, whereas the satisfactory clinical results were 15%, relatively satisfactory results at 32%, and the negative or relatively positive was in 41%. So I made a graph of this. Let's see what the next slide shows. Yes. So you can see the difference in the graphing of this, that the test group had almost 80% good results, whereas in the control group, we only had about 10%.
Yeah, it is a graphical representation of the previous slide showing the ratio.
Correct.
The same numbers which are...
Correct. So significantly better changes when you have more blood being brought into the brain. 96% positive. Go ahead.
Mm-hmm. Next slide.
In group 2, which was the ischemic stroke group, we saw a MRA, or the Muga data, the visualization, manifest pronounced angiogenesis, collateral and capillary revascularization was obtained in 95% of the cases. In this group, 88% of the small, this is the small focal group, 88% had good complete recovery, so good clinical outcome, complete recovery of mental and motor function. Now, they had a small lesion, they had 88%. Satisfactory, which is a slight incomplete recovery, was 10%. Relatively satisfactory outcome, which is a partial recovery, in a little bit less than 2%. And just a no negative trend was not obtained. So almost everybody had to get better.
Yes.
Even the people who had a partial angiogenesis, they still had improved function and good positive clinical outcome. In the control group, only 21% of the patients had the small focal lesions. Only 21% had a good clinical outcome. Satisfactory clinical outcome was about 25%. And the relatively satisfactory outcome was 42%. So the heaviest was in just a little better. And a relatively positive outcome was in about 12%. So we'll see that graphically here.
Yes. График покажите теперь. Next slide.
Again, you can see the green, the tendency of 88% for the ischemic stroke group. With the small group, this is the small lesions, had a significant, a much better outcome. And even if you look at the relatively negative outcomes, that were practically nil, again, with the transcatheter. Go ahead.
Yes, следующий.
And if we look at the test group 2, which had a midfocal lesions, or medium-sized lesions, we had a good clinical outcome in 60% of these patients, a satisfactory outcome in 25%, relatively satisfactory in 15%, and again, no negative trend was obtained, so nobody got worse. And in the control group of these patients with midfocal strokes, none of these patients treated conservatively had a good outcome. And 19% has mildly, a satisfactory outcome. Again, 24% had relatively satisfactory, and you can see the numbers that the 57% of the midfocal stroke people had pretty much so-so results.
Yes.
Let's look at this clinic.
Okay. Next slide, please.
You can see the trend to these people not having a high relative positive outcome, the control group. Whereas the test group, you can see it's heavily weighted to an, magnificent outcome. So that's pretty good. When we look at the large units, let's go to the next one.
Next one. Следующий slide.
When we look at the test group of the macrofocal strokes, or large area of the strokes, we found a good clinical outcome in 20% of the patients. Satisfactory clinical outcome in almost 40, relatively satisfactory outcome in partial recovery in 41% of the patients, with no negative trend seen in this group, in the treatment group. In the control group of patients with macrofocal large strokes, none of them had a clinically good outcome. None of them had a satisfactory outcome. Relatively satisfactory was only seen in 18%, and a relatively positive clinical outcome where there was some negativity, 82% of the people. The majority of the people with macrofocal strokes will suffer relatively, almost negative results. Let's see that.
Next slide, please.
So heavily weighted to poor outcomes if you were in the control group, but still very, very little relatively positive or very, very little negative effects in the transcatheter treatment group, and a very, very positive association between a positive outcome with the treatment.
Next slide, please.
In conclusion, transcatheter intracerebral photobiomodulation is pathogenetically grounded and is an effective method of treatment of ischemic lesions of the brain. Stimulating angiogenesis, laser energy promotes cerebral revascularization and restores collateral and capillary blood supplies to ischemic tissues. By influencing the exchange of ATP and mitochondria of neurons, laser energy improves cellular and tissue metabolism, stimulating neurogenesis. Laser energy causes regenerative processes in the cerebral tissue. This complex laser action during transcatheter intracerebral photobiomodulation allows to significantly improve the daily life activities, restore cognitive and mental functions, and reduce the level of dementia in patients with different severity of cerebral ischemic lesions, thus allowing them to return to an active daily life. The obtained positive clinical results is observed for a long period of time. In general, conservative treatment has a positive clinical effect on early, lighter stages of cerebral ischemic lesions, but still has good even further. If we could subdivide those into the years and the time, let's see, we see that this thing. Go ahead.
Okay, следующий. Next.
So,
That's it.
The point is that these changes were in the 90% positive outcomes, which I wanted to just
Я
highlight.
хотел подчеркнуть, что эти результаты ваши почти 90%. Поэтому хотел подчеркнуть это, показать еще раз. Like a summary, right?
но дело в том, что, понимаете, здесь как? Хороший результат, очень высокий процент при мелкоочаговых инсультах. Small focal stroke. Small focal stroke.
Small focal.
Да.
With good results are with small focal strokes.
I don't, but nobody died, nobody got worse, and 90% of them got better.
Стало хуже.
Еще раз, я не понял, Александр.
Никто не умер, никому не стало хуже.
Никто не умер, никому не стало хуже.
Yeah.
That's right.
Только положительно. Only positive results, even slight or big result.
That's correct.
Yeah.
Now, my technical questions are this.
Yeah.
The changes of the intracatheter laser happened first to change the arteries, or did it change the brain? Which happened first?
Change the...
You put the light. Did the light change the vessel, or did the light change the brain?
Освещение меняет сосуды или меняет мозг?
Нет, Александр, я что-то не совсем понимаю вопрос. Дело в том, что они не меняют мозг. В принципе, освещение вызывает ангиогенез, с одной стороны. То есть ангиогенез – это...
It doesn't change the brain. It changes angiogenesis. Genesis.
Эти сосуды природой заложены в мозге и в любой другой ткани.
Vessels are introduced into brain by nature.
I understand.
Но они не функционируют.
But they are not functioning.
После воздействия геля неонового лазера эти сосуды открываются.
After the laser action, they are opened.
И одновременно с этим, поскольку излучение проникает вглубь ткани головного...
Короткими фразами. And at the same time, поскольку что проникает?
Лазерный
Laser radiation penetrates куда?
на 30-40 миллиметров.
Deep to 40 millimeters deep.
Это воздействует на ткань головного мозга.
This acts on the tissue of the brain.
Что стимулирует нормализацию обмена
Organization of interchange.
аденозин-трифосфата. АТФ, можете сказать просто.
ATF.
Одновременно стимулирует нормализацию обменных процессов во всей ткани головного мозга.
At the same time stimulates organization of processes in the whole tissue of brain.
И вызывает регенерацию ткани головного мозга.
It causes regeneration of the tissue.
Very good. Thank you. So,
ATF это, как вы сказали, фосфат.
Аденозин-трифосфат.
А вот первое слово.
Аденизин.
Аденизин-трифосфат.
I got you. So, the question is, the changes that you saw 2 hours after intervention,
Изменения, которые вы видите через 2 часа после введения,
were the activity of the laser on the blood vessel walls, correct?
это воздействие лазера на стенки сосудов.
И на ткань головного мозга.
On the action on the tissue of the brain.
So, I mean, what?
Два, да, и на то, и на другое.
Both.
Okay.
Оно проходит через сосуды, да? Через стенки.
Проходит через стенки на 20-40 миллиметров.
It passes through the walls deep to 20 to 40 millimeters.
So, my question is, what is his theory on the ability of the energy of the brain to increase so greatly in a short period of time?
Какая у вас теория, какой теории основана то, что у вас в течение такого периода времени, как 2 часа, у вас происходит такой эффект? Какая? What's the physics of the process, right?
Theory.
Теория.
Ну, понимаете, это не теория, во-первых, это практика.
It's not theory, it's a practice. So вы экспериментально это получили, да?
Это получили экспериментально еще в
They obtained experimentally.
Еще в 1982 году.
В каком году?
В 1982.
In 1982. So, а у вас есть обоснование какое-нибудь этому?
Дело в том, что
if you have some theoretical substantiation to that effect, okay?
Ну, давайте я расскажу.
Да.
Нервная ткань, она оптически активная среда.
Nervous tissue is optically active medium.
Скажите ему так, если посветить лазером
If you illuminate with laser,
в торец нейрона,
куда?
торец,
In the end phase of чего?
нейрона,
Of neuron.
то на другом конце нейрона
Other side of neuron
будет удвоение длины волны.
will double the wavelength.
То есть, если посветить, скажите,
Light at the end phase of neuron on one side, then other side wavelength doubled.
то есть, если взять yak-неодимовый лазер, 1,06 – это длина волны.
If you take laser with 1.6 wavelengths, nanometers, да?
Yes, да.
Nanometers.
То на другом конце будет 533-535.
Then on the other one will be 532 nanometers.
Yeah, да.
Nanometer.
Wow. Well, I mean, but he's looking at the brain and the laser interaction in a way that most of us have never and will never see it.
Значит, на эти все явления мы смотрим со стороны, которые никогда никто не видел. Новое что-то.
Но дело в том, что, скажите, что PBMT занимается уже много лет.
PBMT is studied for many years already.
Но при этом все пишут о том, что улучшается кровоснабжение.
Everybody is saying that blood circulation, blood supply is improved, but
Но никто не делал ангиографию до и после.
Nobody did angiography чего?
До и после.
А?
До и после.
Nobody made the angiography before and after, even if they study for so long.
I agree. So
Дайте я доскажу, Миш, извините.
Yes.
Дело в том, что я шел просто с другого конца.
The thing is, he just moved from opposite side.
Поскольку я по образованию сосудистый хирург, я начинал со стороны сосудов.
By education, he is a vessel surgeon, and he started from this point of view.
So one of the questions is the absorption of the light through the vessel wall.
Света через стенки сосудов. Поглощение света через стенки сосудов.
Это не поглощение, прохождение света.
It's not absorption, but passing, transmission through.
Есть какое-то поглощение, но проникновение большое.
Small absorption, but mostly penetration through.
And that goes to the cerebral tissue.
Yes.
So what does he think about, what is his perspective on people who are doing it on the outside of the skull?
People outside of...
If I put my laser on the outside, he's putting his laser on the inside. What does he think about us doing it?
Снаружи подвести лазер.
В том, что транскраниальная PBMT существует, ее много выполняет, и очень хорошие результаты. Транскраниальная. Транскраниал.
Я плохо слышу слова.
Transcranial.
Transcranial penetration is studied already.
Много делают и очень хорошие результаты.
And it gives a good result.
Но просто всему есть свое показание. Одним больным надо делать транскраниаль.
But there is a difference between one patients need transcranial, others need internal. Другим нужно внутреннее.
Да.
Yeah.
So has he ever done the angiography with transcranial?
Когда-нибудь делали транскраниальную ангиографию?
Нет, после нет, я не делал, скажите. После...
After he never did it.
What was the thing? Could he describe the changes in the dementia
Вы можете описать
criteria?
Критерии деменции.
Что именно?
What in particular?
So in the patients that had the vascular dementia or other cognitive impairment,
Пациент, у которого была васкулярная деменция.
I would like to see the MMSE scores. I'd like to see those scores, how they changed with each
Как
lesion.
изменяются показатели для людей, которые имели деменцию?
Значит, если это брать болезнь Бицвангера, то есть Бицвангер disease,
This is Binswanger disease.
то если у больного была деменция на уровне CD1,
If dementia was on the level of CD1,
то она прекращается полностью.
it is completely disappeared.
Если CDR2,
If CDR2,
она обычно переходит в CDR1.
it transferred to CDR1.
Если CDR3,
If CDR3,
то она переходит в CDR2, иногда в CDR1.
it goes to CDR2, sometimes CDR1.
Здесь зависит от того, какая часть мозга атрофирована.
It depends on what part of the brain is atrophic.
То есть, когда уже выраженная атрофия,
Когда выражено, да?
да,
When it is explicitly expressed atrophy,
то тогда нельзя,
then it is impossible.
как сказать, сейчас я скажу, нельзя заставить регенерировать мозг на такой большой процент.
Brain cannot regenerate to such high percentage.
That's high percentage. Can he? Have you looked at changes in the pulse pressure or vasoelasticity after your treatment?
Вы проверяли пульс и давление и эластичность после ваших...
Обычно ничего не меняется.
Что?
Ничего не... Как-то пульс меняется, давление тоже не меняется. Иногда давление нормализуется.
No change in pulse and pressure.
Because it's always the same. But so did he have, did they stay open or are they more flexible afterwards to give more blood?
Они остаются открытыми после обработки или они потом немножко обратно?
Нет, понял. Дело в том, что они остаются в таком же виде, и с годами эта реакция больше усиливается.
They remain the same, and with the years past, the reaction is even improved. Иван Васильевич, может, скажите ему про вашу теорию насчет Альцгеймера, что вы думаете воздействует на эти дела?
Это не тема доклада.
What does he see happening in the future? How does he see his discoveries being processed and used, implemented in 10 years from now?
Что вы думаете, как вы думаете о том, что ваша эта теория, все это ваша разработка в будущем, какое у нее будущее? Через 10 лет что вы думаете об этом будет?
Я думаю, что через 10 лет она, конечно, получит широкое распространение.
He thinks in 10 years his theory practice will have widespread application, practical.
Но вот я расскажу такую историю.
He will tell one story.
Где-то 10-12 лет назад
10-12 years ago,
я говорил с одним американским доктором в Париже.
With one American doctor,
который мне сказал,
who told him,
что нужно не проводить интервенцию, когда лечишь больного.
It's not necessary to conduct intervention when you treat a patient.
Поскольку это дешево.
Что?
Это дешево, поскольку это дешево.
It's very cheap, not expensive, inexpensive.
А надо придумать очень дорогую таблетку.
You have better to invent a very expensive tablet.
Которую нужно будет пить всю жизнь.
You have to consume
over and over and over and over again. There's a block. There's a block.
Не все, Иван Васильевич, не все могут залезть в сосуд. Это очень требует аккуратности. И риск.
Риск там небольшой. Дело в том, что ангиографию головного мозга делают, если я не ошибаюсь, с 1957 года.
Okay. I ask if it is dangerous to get maybe more responsibility and risk when you go into brains. He said angiography is done for many years.
Yeah, I agree.
But to put stent once and then replace it and do it many times, then because his system is irreversible. It's not reversible.
That's perfect.
But stent is reversible. Я сказал, что put stent, его надо потом опять убирать. А у вас это нереверсивное.
Я просто хотел сказать одну вещь, понимаете. Скажем, у меня не было осложнений на фоне проведения этих интервенций.
He had no complications of the background of his work.
При этом, что я сделал несколько тысяч операций.
You made several thousand operations.
I agree. Now I'm going to ask him.
Секунду. Я знаю клиники, в которых сделаны десятки и сотни тысяч ангиографий.
He knows clinics where hundreds, dozens and 100,000 angiography done.
И практически они не имеют осложнений.
And never angiography caused any complications.
I understand. I have a question on his perspective of cardiovascular disease, heart problems, and brain problems. What does he see as the correlation?
Он смотрит в перспективе между... И какая корреляция между вот этими болезнями, что он назвал?
Не понял вопрос. Корреляция чего?
Correlation of what? Of
Heart problems and brain problems. Which one comes first?
Что первое приходит, сердце или мозг? Какая корреляция между болезнью сердца и болезнью мозга?
60% болезни сердца, 40% болезни мозга.
60% is heart disease and 40% brain.
Has he ever worked on both at the same? Has he ever done light to the heart and light to the brain?
Вы делали когда-нибудь это со светом в мозг, и с лазером и в сердце?
Да, одновременно нет, по очереди, да.
Not simultaneously, but in a sequence.
Very good. Very good. Very good. Well, I'm sure that we're going to have a lot of people interested in this topic.
Нет. Он считает, что будет очень много людей заинтересованы в этой теме.
And probable. And someone's going to be answering a bunch of emails, I think. So.
И вы получите большое количество имейлов.
Хорошо.
So I want to thank you for staying up. I thank you for your great work. Thank you for your time.
Окей, спасибо за время. Все. Will you appoint exact time of conference?
Yes, I will. It starts on Tuesday.
How much time does it took this time? It's about 40 minutes? Or